I'm Dr. Winnie Wong, nurse practitioner. I have Dr. Lee Krushka here. She's also a nurse practitioner at Anling Health.
So today we're going to talk about gout, which a lot of people actually probably may experience in gout in the past, or maybe heard of people talking about it. So Dr. Wong, and what is the gout?
It is when you have too much uric acid in your blood. And how do you get too much uric acid? So of course, your body is building up too much, or your kidney is not able to excrete it out with your urine.
So a lot of time, a patient actually not experiencing until they already have some symptoms. So doing the actually routine blood work, we don't automatically check in the blood for the uric acid. But what we do it is when patient are experiencing some symptoms, or maybe they have some comorbidities, and we need to check out if there's a possibility that patient have increased the uric acid. So what kind of symptoms that patient might experiencing?
Yeah, the most common symptoms is you're gonna have redness, swelling, sharp pain to your big toes. You can have it in other joints. Usually it can move from your toes, your feet, up to your wrist and your arm. So it can actually happen in many different joints.
Right. So also the really what the difference is between that gout and maybe other joint inflammation such as rheumatoid arthritis or maybe osteoarthritis is the timing. So gout most of the times happen overnight and happen really quickly, and other arthritis usually it's long-term or chronic, and they happen gradually or progressively getting worse. So that's a big difference.
And that is correct. So what type of risk factors might cause you to have gout?
So the risk factors can be vary from person to person. The most common one could be overweight, or patient are having obesity, or maybe taking have a high blood pressure or kidney disease.
And also on your diet, also if you like to eat a lot of red meats, and if you like organ meats from animals such as liver, if you like to drink a lot of alcohol, especially like beer, those will increase your risk of getting gout also.
And don't forget about seafood, and can also exacerbate the symptoms as well. So in South Florida and by the ocean, that we have a lot of patients who do like seafood such as the shrimp, and that can also exacerbate the symptoms and have that overnight painful, and they're not gonna forget.
That's correct. And what should you do? You can go ahead and schedule an appointment with your PCP. Your PCP can professionally treat you in the office. Of course, they can check your uric acid level to see if it's higher than normal, and also will give you medication. So what type of medication is usually anti-inflammatory medication that will help you lower your uric acid level?
That's right, and also those tests to be done is through the blood, which is most accurate, and so the pain is very painful, and that should be treated right away. So as soon as you have the symptoms, start do a Google, and should be actually seeing your PCP and having to diagnose you and accurately.
Yeah. Treatment can be very manageable after you have the treatment to lower your uric acid level. The pain can be alleviated quickly.
Right, and also the education about diet in the future to prevent from recurrence is also important. So if you want to know a little bit more, please follow us at Anling Health. And this is Dr. Krushka, nurse practitioner.
And I'm Dr. Wong, board certified nurse practitioner, just like Dr. Krushka. See you guys soon.
Bye-bye.